morning, I'm Angelique with CDC News. Tonight we're discussing masks. How do they work? What types of masks work best? Is mandating masks legal? All this and more in today's newscast. I'll hand it over to Grace for a look on how masks work.
Thanks, Angelique. I'm Grace. Masks have become a staple in our everyday lives. According to the Economic Times, masks have emerged as the single most important non-pharmaceutical intervention in containing the spread of COVID-19, along with physical distancing and hand washing. But how do they work? The Association of Anesthetists explained that COVID-19 is predominantly caused by contact of droplet transmissions, attributed to relatively large respiratory particles, which are subject to gravitational forces and travel only approximately 1 meter. However, they state that if any respiratory activity generates respiratory aerosols, then aerosol droplets can become airborne and travel a much further distance. By using a fluid-resistant surgical mask, the Association of Anesthetists says that, in a medical scenario, patients and staff can protect each other against droplet transmission within 1 to 2 meters, reducing the risk by almost 80%. But fluid masks aren't commonly used among the public. So how do more common masks work? The Association of Anesthetists answers this question with the N95 mask, a high-performance filtering mask. This mask, along with others like it, achieve filtration using a combination of a web of polypropylene, microfibers, and electrostatic charge. The 95 in the name N95 means that, under testing conditions, the respirator blocks at least 95% of solid and liquid aerosol test particles. Now that we understand the basics of how masks work, we can discuss their effectiveness in public. It is nearly impossible to achieve 100% compliance with mask mandates, but according to the Economic Times, a study from June shows that even 75% adherence in the population can lower COVID-19's reproduction number to less than 1, without resorting to lockdowns. This reproduction number is the number of people that an infected person can pass the virus on to, which when less than 1 means that the spread of the disease can slow. Now that we understand how masks work to protect others and slow the spread of the virus, let's turn it back over to Angelique for information on different types of masks.
There are several types of facial coverings or masks you can wear to protect yourself from the virus. The medical grade N95 is the most effective. It doesn't allow any or a lot of water droplets in, and as the name suggests, it blocks 95% of small particles. And the next in line for most effective is a surgical mask. It protects against large droplets and splashes of bodily fluids. And then there are other alternatives besides wearing these two masks, such as bandanas, neck gaiters, and then homemade masks. This is the incorrect way to put on a mask. This is the incorrect way to take off your mask. This is the correct way to take off your mask.
I'm Carter, and I'm here to talk about how to correctly put on a mask today. So, as everyone knows, at the start of the COVID-19 pandemic, a lot of places have made it mandatory to wear a mask, and they should be aware as it reduces the risk greatly of the coronavirus being spread around. So, when you take a mask, you want to make sure your hands are clean. So I would wash your hands or use some hand sanitizer before you touch your mask or put it on, just to make sure that you don't get any bacteria or germs or anything like that on your mask to contaminate it. And then you put ear loops around the ears, and then you want to put the mask over your face in a way that it covers your nose, your mouth, and your chin, leaving no room for anything to be exposed. And if you work in the medical field, then you should wear a medical or surgical mask, which are made better and reduce the risk of it being spread even more. They recommend that for people over the age of 60. But if you see someone out in public that does not have their mask on over their face, covering everything like this, I would be careful around them because they are not protecting themselves from spreading it or getting it. So to protect yourself and others, I would avoid doing that and make sure it is covered across your face like this.
Thank you for the demonstration, Carter. Now that we've talked about the practical use of masks, we'll shift our focus to the legality of mask mandates. As far as private businesses go, it is legal to refuse service to any customer for not complying with the posted mask rules. Some people argue that because of a medical condition, they cannot wear a mask. This argument was challenged in the case Pletcher versus Giant Eagle in the Western District of Pennsylvania. One of the plaintiffs claimed that the Giant Eagle grocery store's mask policy violated the ADA, or the Americans with Disabilities Act. This plaintiff was diagnosed with several mental illnesses, including PTSD and an anxiety disorder. However, there were no medical records indicating that he could not wear a mask. The court stated that they need not evaluate Giant Eagle's well-taken defense, that its policy covering is a legitimate safety requirement during the COVID-19 pandemic, and that the plaintiff presented a direct threat to the health and safety of others, including customers and employees. Although we have evidence that private businesses can legally enforce a mask policy, it is less clear on whether or not state and local governments have the same power when enforcing masks. According to Lindsay Wiley from the Health Law and Policy Program at American University, state and local governments have really a quite broad authority, particularly in a public health emergency like this, to issue emergency orders. The issue arises not with the order themselves, but how the orders are being put in place. There is concern that these orders are not following the proper process. Governments may be shortcutting the process due to the urgency of the pandemic, but it is costing citizens to question their credibility. So, although these orders in themselves are legal, state and local governments should be sure to follow the correct process for putting them in place. We can now take this discussion to an even further level, up to the federal government. President-elect Joe Biden discussed a nationwide mask mandate on several occasions throughout his campaign. Biden stated that, when asked about this question, "Our legal team thinks I can do that, based upon the degree to which there's a crisis in those states and how bad things are for the country." With COVID cases reaching a record high in nearly all states, this mandate may be necessary by the time Joe Biden is inaugurated on January 20th, 2021. The argument many have when it comes to this issue is that these mandates are up to the states. ABC noted that Biden addressed this by stating that he'd work with the scientists and make the case to governors to determine whether such federal action is needed, allowing states to have a say in the participation in the mandate. This pandemic is something that our current political system has never seen and was unprepared for, so it is difficult to determine what the limits of power of governors and legislatures are. However, as long as it is implemented correctly, it is legal for private businesses as well as state and local governments to enforce mask policies and mandates. Now, let's turn it over to Angelique for a street interview.
Hello, this is Angelique coming to you live from Flint, Michigan, and this is...
Hi, I'm Latisse.
And we're going to be asking some questions about masks. So how do you feel about masks?
Honestly, I don't really like the mask because it's hard to breathe. I can't really get oxygen whenever I'm wearing a mask. It's just like, I can't really get that much air. So.
Did you know that actually your oxygen levels don't decrease when you're wearing a mask? It was shown when using an oximeter that oxygen levels don't drop even when wearing 5 masks.
Yes, I have something to say about the mask. We don't need masks. They don't actually prevent us from being sick. They're just trying to control us to say that, we have to wear masks because they say to control us.
Well, did you know that masks actually help in reducing the passageway of particles coming from each person? That's what the mask does, is it acts as a barrier from those particles, which would prevent the virus from spreading if there's something blocking it. And the UK also found if they got the entire population to wear masks, it could be enough to slow the virus without resorting to lockdowns.
It's Carter, again, talking about now the ways over the last 8 or 9 months that the pandemic and the coronavirus have greatly infected and changed everyone's lives. Some of the most obvious ways is, like I talked about in a previous segment, mask up. To go into most public places, you are required to wear a mask so that you reduce the likelihood of you spreading or catching the coronavirus. Places like that include stores like your retail stores like Target or Walmart. Like everyone's masked up. There's glass in front and behind at the cash registers. And then social distancing, not going within 6 feet of others. That is a huge way it has affected. Not being able to go up and shake hands with somebody and give high fives, things like that. Other ways that are huge are school. A lot of people have not been in school since March or February because of the pandemic. Some people have gone back, or their colleges have like mixed mode classes, such as U of M Flint. But other people have been all virtual since then and have not seen their friends in person and seen their instructors other than over the internet. So those are some of the biggest ways that this pandemic has changed the way we live. Another one, a lot of people can't just go in and eat at restaurants anymore. A lot of carryout has become increasingly popular, as a lot of restaurants do not offer the option to sit in, and even if they do, it is limited seating. That is all for the segment today. I'm Carter, and have a great day.